I'm Jeff Flax, the President and Chief Executive Officer of Hartford Healthcare. Thank you again for joining us today. I want to first begin by recognizing the absolute remarkable work that's occurring by all healthcare workers today, all of our colleagues who are working on the front lines during really extraordinary circumstances and doing a truly amazing job of responding right here in Connecticut to this crisis. These people who work in our organization and across all healthcare organizations are truly stepping up in a truly unprecedented manner. Every day as we go forward, we continue to make adjustments and build on the work we're doing to respond to these issues. And today in particular, we want to speak about 3 advancements that we're making within our health system and for our community. First is we have now piloted for a number of patients drive-through testing. And we'll speak in a moment to the work that we're doing with respect to protecting our staff members and making testing more accessible and more efficient for the people within our community. Second is we will be piloting right here within our command center for patients who call. And there's been thousands of people who've called our command center. But for patients who call us or people within the community, they now will have access to telehealth visits where we will create virtual health visits, a capacity for our clinicians, our physicians and nurses, and advanced practitioners to immediately, through an accessible means, take care of patients and help triage them and care for them in the best possible manner. And third, through this process, is we are now putting forth, through text messaging capability, a push technology where we will be sending out real-time the most relevant, important, instructive information to thousands of people through those who've signed up for our COVID-19 text system. So I'm very pleased that we're continuing to make these important advances. Just in the last several days now, we've activated our hotline here in this command center, which thousands of people have already taken advantage of, and our team who's supporting them have done an exceptional job. We've developed a website that's public-facing, that has been very active, and is leading people to the right place and providing essential information real-time, 24 hours a day, 7 days a week. And we have put forth, through our partnership with our GoHealth network of 22 urgent care centers, we have started using telehealth capabilities for virtual visits that allow people to receive care and attention from the comforts of their own home. And lastly, as we discussed yesterday, we have now enacted visitor restrictions that we've put in place in all of our facilities, both protecting the people we're caring for during their most vulnerable time, and at the same point protecting the people who are providing the services and clinical support to our patients. So I do believe, again, we're making great progress. We're responding to the issues at hand, and we have an incredible team of brilliant, dedicated people who prepare for this work each and every day. It's my pleasure to introduce our Chief Clinical Services Officer, Dr. Ajay Kumar, who will further elaborate on the efforts that we're putting in place.
Thank you, Jeff. Thank you, everybody. So Jeff's leadership, Jeff challenged us back in December. I said, we got to be ready for this, and we need to stay ahead for the community and the service we provide to the folks in Connecticut. And I think our team actually has really come together in multiple levels. I just want to go back. We started preparing for this in early January, and I think our hard work and our preparation has really paid off. So far in Hartford Healthcare, thank God, we have not seen a single case. We've not had any positive case. We've tested many, and all those individuals who came who were person of interest or we were concerned about, they were managed and triaged very appropriately in the right level of setting. And that is what is required for the preparations to happen. That's how we stay ahead. We've not seen, and we don't intend to have any cancellation of our services in any area, whether it's the surgical centers or any area. We are very well prepared. We have equipment, we have people, we have training. So we've really covered all those angles. Now, as Jeff keeps pushing us to think differently and be staying ahead of the curve, some of the investment we are doing and some of the advancement we are doing in our system is going to position us differently. So Jeff talked about the drive-through. The commitment was, how do we protect our community? How do we protect our colleagues for individuals who may be exposed to COVID-19? So we've had a system, as you can see one of the photographs here, where individuals who actually may have some symptoms, have a travel history, they can drive up to a location and get tested done. They don't even have to step out of the car and get the testing done. And tests can be sent and inform them later on what the test result was. We're still in the pilot phase. We're still early in the stages of making sure that all the infrastructure testing capabilities are in place. As you've heard, that we've had mixed signals about the testing capabilities, whether through the labs or DPH. We're still in the final stages of determining where we are going to be with that. But when the system is ready, we are going to be offer the service to our community where folks can be directed to a testing center and they can get the sample taken at that time. Now that is one piece of that. The other piece, which is the latest in our elements of services we provide, is the telehealth and virtual health. I have the utmost pleasure of introducing my colleague, Dr. Mark Preet, who is the president of our medical group, who's going to talk about who's been leading this effort. Mark.
Thank you, Ajay. So Jeff challenged Ajay, and Ajay challenged me. And what I see is telehealth, and you can use the term telehealth, remote, virtual visit pretty much interchangeably. But the concept is that there are certain patient encounters that can be served through the facilitation of a visit in a computerized environment, either by phone or by video, and that can be an appropriate encounter to deal with COVID. And what I mean by appropriate, we're not replacing the PCP. There are certain visits that still need to see their primary care doctor. There are certain visits that need to go to urgent care, and certain ones that need to go to emergency care. But the COVID environment really does set up the possibility, because we've seen it through this center, that there are certain visits that could be served through a virtual visit here, because a lot of them are generating questions that we can answer, whether it's travel screening, whether it's symptoms, and we can serve those patients here and provide a good patient experience. It also aligns very much with what Ajay talked about testing, because we'll have the ability to, through that encounter, order that test and make sure the patient gets to the right testing center. So that's really the concept. But what we're also doing is providing the ability to mitigate exposures of patients to offices where they shouldn't be and don't need to be. We're limiting resources of protective equipment because we think we can handle these through a virtual visit. That's the basic concept.
Thank you, Mark. So today, actually, I came prepared with a lot of people with me because you're asking a lot of difficult questions. But before we go there, I want to have Beth maybe talk about how the center is doing at this time.
Thanks, Ajay. So we're very excited that our center is still receiving lots of calls. We've received over 1,300 calls so far, continue to get them from around the country, and continue to get calls not only from clinicians, but from families that are worried about their loved ones, as well as from people who are concerned about themselves. So I would just continue to tell people to call us if you feel that we can help you in any way. If you've called us a few days ago and you have concerns that your symptoms have gotten worse or you've thought of more questions to ask, please, again, give us a call. We're here 24/7, and we'll be more than glad to answer anything that anyone might have to ask.
Thank you, Beth. Just want to add on to that. Beth indicated earlier on more than 1,500 calls have already come through. We've had calls from almost 11 or 12 states across the country. And we have calls coming from a lot of physicians from different healthcare systems at the moment asking our advice. Earlier on, I was informed a lot of infection prevention, infectious disease doctors of other healthcare systems are seeking our help as well, and obviously reducing some of the burden to be able to manage the anxiety we have in the community. Look, we have been prepared in this place for something like this to come, and our call center, the agility our team has to put this together has been remarkable. So with that, as I said, I have a lot of experts today to ask any questions. So I'm inviting any questions from anybody at this time.
Doctor, it was mentioned that there may be, you guys are refining the isolation and with a screen in a negative pressure environment. There's a screen.
Yeah.
Could you?
Sure. Just to kind of level set what Josh is asking is the negative pressure room is a specialized room where we can take care of individuals with significant risk of spreading the infection, the contagious or some sort of a risk of air droplet infections. We have capabilities in all our system, throughout our system, in all 7 hospitals of those specialized rooms where we can take care of those patients. Now, what we are doing at this time is that through our call center and care logistics center, if the patients are being transferred, hypothetically, if somebody has a COVID positive patient who needs to be transferred, or person of interest which we think is highly likelihood the patient might have a symptom, our call center can direct our emergency rooms to be ready, and our triage area is separate and the room is separate, where this patient can be taken care of very well in a contained environment. Now, it's important not just for the patient, but at the same time, our colleagues who work in Hartford Healthcare. We've been very careful about how do we actually make sure that our colleagues are working in a most safest environment, and this kind of a system provides that capability to us. Yes?
The drive-through pilot testing, obviously you're still working it out. Do you have any idea of when it will be available and an estimate?
We will be hopefully give you a much clearer picture on Friday on that part. I'm hoping by Friday or early next week, we will have something ready. Yeah.
Greenwich said they got permission from DPH over the weekend, and I will add that they may be a little different. They want a primary care doctor order for a test and an appointment. Does your drive-through system contemplate? Does the person need a primary care appointment?
Yeah, so I'm not entirely sure what's going on in the Greenwich at the moment here. I can tell you what we are focusing on. Our focus is how do we make it easy and safe for our patients? How do we make it easy and safe for our colleagues at this time? The way we have piloted this out, that our call center here will have a virtual visit where individual would be advised they need a testing, and they could drive up to a place where located area where the testing would be done. So that's the pilot we're putting this together. As you can imagine, this is a logistical challenge, and Hartford Healthcare has all the resources and technology and capability to make it happen. A bottleneck had been the availability of the tests, which we are hearing some news, at least today, that might be easier this time, especially the private labs will be able to offer that service.
Could you just describe for us what it would look like? I know it's a little early stages. When people drive up, so they're not excited about it, just describe what they can expect to see.
They can expect to see drive up and greeted by one of our colleagues warmly and reassuring way. And that they will see somebody holding swab, which swab will be taken from the nose and the mouth and will be sent away, and they'll go after that. They need to register some registration of what needs to be done.
And some paperwork, I imagine, or is it all?
We would like to do all through our call center electronically, and that would be done prior to their reach there. We want to make it as convenient as possible.
How long does it take to get test results back?
It varies depending on which lab it's sent to. Right now, our turnaround time from DPH is generally 24 hours. Turnaround time from Quest, if Quest is allowed to do in this area because they have some issues, is about 48 hours. The LabCorp is about 2 to 3 days at the moment. That's where we are right now.
As far as the information that's being pushed out to mobile devices, are we getting information from the state level or worldwide at this point when it comes to COVID-19?
I'm glad you asked this question. So one of the challenges we have is a lot of misinformation to a certain extent, which has been happening. So our team has been watching the trend across the world, across the country, in Connecticut, and how we are responding. And we're putting out the latest information on our website. So the text message allows you, the community members, to be educated. I think that's very important in these times. Number one, get the information from the source which we think our experts have validated and looked into appropriately.
Since we are streaming live on 3 stations, how can they access it?
How can they access the text messaging?
Sign up for it.
Oh, it's you have to, and you got me here, 3. It's right there, somewhere in the paper here. And it is, come on, 319-31996, I'm sorry, 31996. Thanks for asking.
Say it again.
31996. And in the text message slot, you write COVID-19, no space, COVID-19. And you will get an automatic text message from our system. And I'd like to remind everybody our call center number as well, 860-972-8100, 24 hours. And I want to remind everybody this is the clinicians are sitting here who are advising. We have infectious disease doctors, we have internal medicine doctor, we have nurses who are helping the community members.
Could you just say again about the mixed message? Are you getting a mixed message from DPH about when to start drive-through, or when to,
What I meant about the mixed message earlier on, the sources of information about the COVID-19, some of the areas I'm hearing some of the community members have called asking, is it a hype? It's not a hype. It's a real issue we're dealing with right now.
People looking for reliable
And people are looking for reliable, consistent information and up-to-date information, and that's what we're providing here at the moment.
has DPH given permission needed, or is permission needed from DPH to go ahead with the drive-through?
So DPH has been actively engaged with us, and we've had conversations. I missed a meeting just before this meeting where this was discussed earlier on. We will have a lot more clarity on that tomorrow. But we are ready. Many of the doctors are eager to answer any questions about coronavirus at this time. About the virus.
If you want to grab them separately, you certainly can, but if we do that, we'll do that outside of the command center because we are a little disruptive.
I'm going to have Jeff say some closing remark, and I'll step away from here. Thank you.
Yes, thank you, Ajay. And again, I thank our entire team who are really stepping up at this moment for our community. We will continue to keep the public closely informed. We want complete transparency, accessibility to who we are, our services, and what we do. And we are working to do our very best to be as responsive and as engaged for our community during this time as we possibly can be. And thank you very much.